So this is a fun video for the many people that have asked over several years, what is it exactly that you do in theatre and what do you use? So I've brought together a set of 4 things that I can show you. These are the tools that we use in surgery, whether it's a sleeve or a bypass. I'm going to show you a bougie, a energy device, a stapling gun, and the staples themselves. This is just so you've got an idea of the size of the things that we use and a concept of, okay, when I'm talking about the stapling gun or the bougie, what exactly am I talking about? So to start off with, the bougie. The bougie is quite literally a plastic tube. It goes in after you're asleep, but it comes out before you wake up. So this is a 38 French tube, so it's about 12 to 13 millimeters in diameter. After you've had your surgery, bear in mind that this is the size of the inside of your stomach. So don't eat anything more than you think will fit through a tube that's this big. There will be some swelling in the first few days after your surgery, so it'll be a little tighter than this, and then over time it'll get a bit bigger. At the very bottom of this tube, you'll notice there are some small holes. That's to allow us to suction out any gas or any liquid. So that's why I ask that you don't have any solids for 24 hours before surgery. And sometimes if you're diabetic, I'll ask you to have only liquids for 48 hours before surgery. So it goes in and we use that not only to size your sleeve pouch or your bypass pouch, but also I ask the anaesthetist to put some blue dye down this so that we can check for any leak at the time of surgery. It's not 100%, but it's a really good test. You will notice that your wee will be green for a few days after surgery. That's completely normal. That's purely because of the blue dye. Also, you might have a bit of a blue tongue, like a blue tongue lizard. Again, that's the methylene blue dye. Okay, so that goes in after you're asleep and comes out before you wake up. Next up, while that's in your stomach, I use an energy device. The energy device itself, it's about this long. It goes in through one of the 5 holes in your tummy. What this is used for is, particularly for a sleeve, the stomach has natural fat that falls off from it. I need to separate that off so that I can staple along your stomach. This does 2 things. Number 1, it seals and makes sure that there's no bleeding when number 2, cut the fat away from the stomach. So it does 2 things at once, and we go along the entirety of the larger curve, the greater curve of your stomach. So that's the energy device. Number 3, staple gun. So there are several types of staple guns. There are manual guns and there are powered guns. So I tend to use a powered gun in theatre. Those powered guns are used for several reasons. Number 1, it gives you a very even staple line all the way across. And number 2, it'll slow down if you've got quite thick stomachs. So particularly for those that have thicker stomachs, males have thicker stomachs, and your stomach is likely to be thicker at the bottom end compared to the top end of your stomach. What these do is we go in, the stomach goes into the staple gun itself, we clamp it shut, and then it fires. And when it fires, it has a series of staples on either side. So the staple gun will be used for 5 or 6 staple cartridges. The stapler cartridge itself has 3 rows of tiny staples on either side of the cutting device. So on the side of the stomach that's staying in your body and the side of the stomach that's going, you've got 3 rows of tiny staples, and each of those staples is about 2 millimeters long. They form a nice little B shape to seal off, firstly, the stomach that's staying behind, and secondly, the stomach that's going out, so that when I pull it out of the tummy, it doesn't pop. So once that's neatly cut, all of that is taken out of the body. Those are the 4 major things that we use at the time of sleeve surgery, but also gastric bypass surgery. The difference with a bypass is we're more likely to use a suture to do the closure of the small bowel being sutured onto the stomach itself. I hope this helps.